New study found a majority of Americans are living with some sort of chronic aches or pains during their daily lives. Results also revealed people are developing new cases of chronic pain at higher rates than new diagnoses of diabetes, depression, or even high blood pressure. Researchers say it proves there's a need for both prevention and early management of pain before it becomes chronic. Let's talk more about this with Dr. Jeff Potoff, UW Health's Chief Quality Officer. Doctor, great to see you. Surprised to hear chronic pain more common right now in diagnoses than things like diabetes or depression?
Yeah, that's what the study says is when you ask people, over the last year, take 1,000 people, how many of you have been newly diagnosed with diabetes or hypertension? More people are saying that they're having problems with chronic pain than some of those really common medical conditions. I think chronic pain is kind of an under-recognized problem, and lots of times, treated in a way that's maybe too simplistic. Let's take some pain pills or some medications, when oftentimes treating chronic pain is multimodal. There's a mental health component to it. There can sometimes be a physical or exercise component, lots of different aspects in addition to pain medications, but certainly something that I think medical professionals and patients alike maybe need to pay a little bit closer attention to.
And a lot of times we suck it up and we don't tell our doctor, right? It's like, yeah, we've had this thing going on with our knee, but it's not that, it's not that big a deal. But the problem is it can become a big deal if you don't just talk about it, right?
Absolutely. I think a lot of people say, hey, maybe I'm just getting old. I'm supposed to have aches and pains. We kind of accept it as just the way things are, but it can have profound implications on your life, your ability to do things that you enjoy, and then that can lead to things like depression and things like that. So, if you are experiencing chronic pain, don't just accept it as like the way things are. Talk to your doctor about it.
Right, and the answer doesn't always have to be medicine. There's other things, stretching, yoga, all sorts of different options out there. Hey, I want to talk about this because if you use eye drops, listen up, there's a recall. So what's the problem with EzraCare artificial tears?
We've been watching these Ezra artificial tears for a while. There were some initial reports that folks were getting infections in their eyes from a pretty bad bacteria called Pseudomonas aeruginosa. It can be hard to treat. And since that time, we've heard of a few more cases where folks, best case scenario, getting infections. Worst case scenarios, losing an eye, and some people dying. So I think certainly if you have any product of EzraCare or Delsam, you want to take a look at that. Potentially just throw it out. Don't take the chance that this could be one of those contaminated bottles until this gets sorted out.
Some people have gone blind from those eye drops. So yeah, definitely be careful. Hey, the CDC is warning there could be Mpox outbreaks this summer. It was previously referred to as Monkeypox. We had this last summer. What's the concern this year?
Yeah, last year we had that monkeypox outbreak. It kind of got going and then calmed down pretty quick. The concern right now is that we could see a bit of a resurgence of Mpox or monkeypox this summer. We know that it's not exclusively, but more often seen in the LGBTQ community, oftentimes passed during intimate contact. So I think, things to know. If you're a high-risk individual, certainly be open and have that conversation with any intimate partners. It could be awkward, but it's necessary. Then likewise, if you're in a high-risk category for potentially coming in contact with someone with Mpox, there is a vaccine available. Talk to your local public health department, see if you're eligible. Those supplies have been relatively adequate recently. Maybe you would benefit from a vaccination so you don't have to suffer from Mpox.
Yeah, there's a new cluster that was just identified down in Chicago, so it's in the Midwest, something to be aware of, but obviously the more information you have about it, the better. Dr. Jeff Potoff, we appreciate your time.
Thank you so much.